What was your experience with Black healthcare professionals before and after entering the field?
Yeah, okay. That's a good one. When I first entered the field, and I mentioned I started like super early.
You were
Volunteering.
15,
Yeah, I was
right?
15 when I first started volunteering. I was probably like 13, 14 when I started first taking classes. But I remember going into the hospital and not seeing people that looked like me in like professional roles, like physicians, nurses. We assumed a lot of the CNA roles. Like I had other CNAs who were Black, housekeeping,
Maybe
food
the
services.
cooks. Yep.
Those were where we were. And I think early on I already knew that, wow, I'm kind of getting into uncharted territory. After entering nursing, I actually started my career at Rush as a registered nurse. And so I've been here almost 10 years. So that's why this has been my whole entire nursing career. And super important part of that story is that Dr. Fred Brown, he was the hiring manager on the orthopedic unit. And I mean, for somebody like me, I'm coming to a big city. I'm in about Chicago.
Right.
I'm interviewing.
A huge hospital.
Yeah. And I'm interviewing with this man who I can identify with. He wasn't militant. He's like you said, I feel like I'm silly and goofy. I would say so I felt like that's who he was. And so I'm like, okay, he has his DNP and systems leadership. He's a unit director. He's not like, stuck up like a lot of the leaders that I've seen in my earlier parts of nursing. But and honestly, that exposure became everything for me. It was kind of like, I got you, brother. Like, I got you. 5 to 7 years later, 5 years later, I became a unit director. 7 years later, I finished with my DNP. And I always say to him, like this, you helped me realize that's something that I can, become.
What's up, everybody? If you want to see more videos like this, make sure you're subscribed to our channel and click that notification bell so you don't miss a thing.